Hello, everybody. My name is Gemma Delgaudio. I am the Director of Marketing at Perfect Teeth, and we are so excited today to be with one of our amazing registered dental hygienist, Jasper Axelrad. She is serving the Colorado community in Southern Colorado specifically for Perfect Teeth dental offices, and I have been speaking with Jasper for a couple of weeks now on some really great topics, and today we're going to talk about something that's been in the news recently. We're going to be talking about fluoride. So, Jasper, thank you so much for being here with us today. We are going to start by introducing you as a rock star. Her name sounds like a rock star, Jasper Axelrad. We love it. So, Jasper, tell us a little bit about why you got into hygiene, why you decided to become a hygienist.
Hi, Gemma. Thank you so much for having me here. Rockstar, I love that. So I've always been into medicine and especially preventative medicine. And I think that we see a really big shift across the nation in general towards a more preventative nature in medicine. And one of the ways that I found I could help others and find it very rewarding and fulfilling was becoming a hygienist, because I look at the oral cavity or the mouth as kind of the gateway to the body. And there's many things about the mouth that indicate other potential issues or things that go on within the body. And it's a very intimate experience, and you get to learn a lot about people, and it's just a wonderful experience.
Awesome, Jasper. And I'm so glad you are serving our community. We've got some great reviews from our patients from you. And we really want to touch on today, as I mentioned, the topic of fluoride. So we have mentioned that it's been a big topic in the news lately. And a lot of people don't want fluoride. And I just want to know why. You know, studies have come out saying that it's bad for you, don't have it. So as a hygienist, as a concern when you're seeing patients and telling them about fluoride varnish, what are you discussing with them? How are you bringing this up, and how are you showing them the benefits and how to apply it correctly?
Well, that's a really good question. And you're right, that is a major concern. Major universities like Harvard and Yale have come out with studies showing how systemic fluoride is detrimental to development. That being said, the fluoride that is applied in dental offices is not systemic. It is topical. It's a topical fluoride varnish, and it's incredibly important for restoring your tooth and remineralizing it. Over time, your teeth lose calcium. Your enamel, and we're going to use a big word here, your enamel is actually made from calcium hydroxyapatite. And the way that fluoride works is it actually helps replace that lost enamel, and it becomes fluorapatite, which is much stronger against acid wear in the mouth. And pretty much anytime you eat any food or anything along those lines, the pH in your mouth drops. So you tend to lose a lot of minerals. You want to remineralize those teeth. So when I have a patient who comes in who's concerned, they're typically concerned about fluoride affecting their body, their organs, their brain, things along these lines that they've read about in these studies or heard about in the media. However, that's not necessarily true for the topical fluoride with dentistry in general. That's actually your number one way to remineralize tooth structure.
That helped answer that question, right, guys? So, okay, so Jasper, what if you have a crown or a filling on your teeth? You know, when we're applying fluoride in our dental offices, you know, you're an expert in your field. How does the varnish work if you have cosmetic, you know, treatment done in the past, crowns, fillings? Explain that a little bit to us.
Yeah, absolutely. So One of the really important things, especially as we get older, if you're one of those lucky individuals who has absolutely no fillings and just perfect teeth, then you guys can just disregard this altogether. However, if you're like me and the rest of the world who have a filling or missing enamel or any kind of defect with your teeth at all, it's actually helps remineralize that tooth structure over 40%. And it decreases the likelihood of developing at least 2 caries. And caries is just the multiple of a cavity, basically. So you have 60% greater remineralization in general on teeth that don't have a filling or don't have a root surface showing. A lot of people, I think, have heard about gum disease, gingivitis, or periodontitis, where your roots are showing. And with those people, you get over 40% remineralization. So it's really important to try to prevent further decay or recurrent decay under a crown or a filling. That can be super costly, obviously, if you have to have those replaced.
So, Jasper, I have a baby, and she started using fluoride about a year ago. So can children use fluoride? Are we able to put fluoride on children? Is this a touchy subject? What have you seen?
Well, that's an interesting question. I personally do not want to use fluoride on pregnant or nursing mothers because it can transfer through the breast milk, and systemic fluoride can be detrimental to development, like we talked about. One of the conditions that's a very common condition that you see among tons of people is called fluorosis, where there are white striations on the teeth. That occurs from intaking too much fluoride while your teeth are developing. So in your early baby, infant, toddler stages, where those baby teeth are forming or your adult teeth are forming, if you are drinking water that's unregulated, so like well water or water from rural areas that might have really high fluoride content, it can actually disrupt the enamel on the teeth. The funny thing about that is the only way to remineralize those teeth once they've erupted is actually with fluoride varnish. So that is the only way to actually re-strengthen those teeth outside of restorations. So for a child, it is totally safe on, I would say, a child 4+ years of age. I'm sure the American Dental Association has the cutoff on that. But overall, again, you're looking at over 60% remineralization. That means prevention of cavities. So you want to do that.
So guys, the next time that you come and see Jasper for your next cleaning, you definitely want to ask for fluoride treatment. If you want to know more information about fluoride, Jasper is welcome to answering any questions you have. Please stop by and see her. She serves in the Southern Colorado community. She is with Perfect Teeth dental offices, and she's currently practicing out of Cheyenne Meadows location. She would love to welcome you as a new patient. She's always welcoming new patients, and as you can tell, she's highly educated on many subjects. This is just one of what we're going to be talking to Jasper about in the coming months. So please stick around and listen to our next few podcasts. We're going to be touching on a lot more subjects that have been in the news lately. So we want to thank Jasper today just for her time, taking time out of serving her amazing patients. And we look forward to speaking with her again soon. Thank you so much, Jasper.